as you know, metabolic health is obviously a key part of this whole story. And with two-thirds of the population, not just in the US, but Canada, the UK, other places, we see are overweight or obese. We see rates of diabetes, pre-diabetes on the rise. Could you walk us through that connection between weight gain, high blood sugars, and how this is really some of the driving factors behind why folks are struggling with metabolic health?
Yeah, exactly. So, the most recent statistics that we have available for the United States, which come from the 2016 data, a very large study that's called NHANES, that looks at people's nutrition and, outcomes, shows us that actually 88% of the adults in the United States are not metabolically healthy. They cannot meet all the markers of good metabolic health. And, while obesity is sort of a, effect or a symptom of poor metabolic health, it's also important for people to understand that not being obese in no way guarantees that you're not metabolically healthy. So while, overall only 12% of adults in the United States are metabolically healthy, when you look at the group within that study that was not obese, they were normal weight or underweight, actually about 60% of them were not metabolically healthy either. So there was a pretty significant chance of not being metabolically healthy, even if you are normal weight. And that's a very important point that I like to get forward to people. You can't just assume that you are metabolically healthy because you are not overweight. And unfortunately, both physicians and patients make that mistake. And the reality is that plenty of not overweight people make it onto my operating room table. Now, certainly being obese and overweight makes it much more likely that you are not metabolically healthy. About a 92% chance, about a 95% chance of not being metabolically healthy if you are overweight or obese. But, again, you can't just assume it just because you're not overweight or obese. And the reason that it's so important is that we know that metabolic disease, metabolic syndrome, is the biggest risk factor for heart disease and actually for many of the chronic diseases that plague our society. Things like diabetes, many forms of cancer, Alzheimer's disease, all of these have been tied to poor metabolic health. And it's therefore, very important that people focus on their metabolic health and determine if they are metabolically healthy, and if they're not, correct that. But unfortunately, the healthcare system just largely ignores that problem.
Yeah, it's amazing how, as you mentioned, even docs in a busy practice, general practitioners, if someone's, thinner or what appear to be a more ideal weight, then it can sometimes fly under the radar. It's often surprising when people realize that places like India are leaders and have the highest rates of things like type 2 diabetes, where we would think that, again, that with the population not being as obese as other populations, that they should be perhaps lower down that ranking. So that idea of being thin on the outside but fat on the inside, that TOFI type, is definitely something to keep our eyes out for. And if we zoom out to 30,000 feet, when we look at what we're eating, when we look at the ultra processed food that's in our food environment, that's really calorically dense, that's nutrient poor, how much of this is playing into the story around driving a lot of the weight gain and the glucose dysregulation and ultimately poor metabolic health?
Yeah, I think that what we eat is the primary determinant of our health and of our metabolic health. And, we see exactly that, as these processed foods have been introduced and become more prominent in our food supply, the rates of metabolic disease skyrocket. We certainly see this, in the United States and the westernized countries, dating back to the 1950s, 1960s, as these foods became commonplace. And then we can see it today in, populations that were kind of more disconnected, more ancestral populations, as they get introduced to the Western diet and the processed foods that come along with it. Clearly, they start to develop metabolic disease in significant amounts. So, there is some debate about what particular aspect of these processed foods might be causing the damage. There's obviously the camp that believes that it's the carbohydrates, and specifically the more processed carbohydrates. There are other people who talk about, the seed and the vegetable oils. And quite honestly, I think there's good evidence for both. But the reality is that you never really get one or the other. They're always combined in these processed foods. And that seems to be uniquely damaging to our metabolic health.
Yeah, it is amazing when you look at like Canada, again, the UK, the US, we're all over 50% of household spendings on ultra processed food. And we often hear how the Mediterranean diet is often cited as one of the gold standards. And if you were to just take a train from London to Paris, all of a sudden it drops from 50 to 14% only is ultra processed food. And again, like 13, 14% in Italy. And so these countries are just eating a lot more real food, which is a huge benefit to not only hitting your protein targets, getting more vegetables in, and fiber, et cetera. But circling back to metabolic health, so patients are coming into their doctors. The focus is still largely driven on LDL, right? Patients' LDL number is going to be the number that docs are looking at to be able to assess, risk for a patient. And I think this is where there's sometimes some confusion, because whilst it is, a key driver of atherosclerosis, there's also some different camps here that are suggesting that we need to look at more markers to get a better assessment. Can you give us, your take on the one side we have, it's the LDL stupid, just drive it down. And the other side we have, well, let's look at more markers to be able to give ourselves a better reflection of what's going on.
Yeah, I think, there are a couple of things to unpack there, a couple of things that I oftentimes discuss with my patients. So, LDL cholesterol, so-called bad cholesterol, has traditionally been associated with increased risk of heart disease, of cardiovascular disease. And when you really look at the data behind that association is pretty weak. Even in the studies that, kind of best demonstrate this relationship, the increased risk associated to having an elevated LDL level over the baseline of cardiovascular disease is only about 1.4x basically. So maybe a 40% increase.
Yep.
When you look at those same studies or the similar studies that also measure for metabolic disease, most commonly looked at with insulin resistance, that risk associated with insulin resistance and heart disease is 6x. So it's a much more powerful risk factor for heart disease, even if you accept all the LDL data as it is. And, there's much reason not to accept it as it is. Furthermore, what I always explain to patients is that, LDL cholesterol hasn't really been tied to any other diseases besides cardiovascular disease, whereas metabolic syndrome, again, as we mentioned earlier, has been tied to many forms of cancer, Alzheimer's disease, type 2 diabetes, high blood pressure, all of these other conditions that also, lead to people, being ill and dying ultimately. So, whether or not you want to accept that relationship between LDL cholesterol and heart disease, and again, there's many reasons to question that relationship, but even if you accept that relationship, there's no getting around the fact that metabolic health is a more important predictor. And if we focused on metabolic health, I think we could have a much greater impact on heart disease.